my name's Jess, and I'm going to be your student nurse today. I'm going to do some hand hygiene.
Hello.
Hi, what's your name?
Josh Ju.
Great. I'm going to check your name and date of birth, please.
12/28/94. Josh Ju.
Great. Do you have any pain today? Okay, wonderful. And before we get started with anything, I just want to let you know that I'm going to provide and maintain privacy today. Those blinds are closed. And I'm going to provide and maintain your safety and comfort. So you're sitting in a low, comfortable chair. If at any time you feel unsafe or uncomfortable, please let me know, okay?
Sounds good.
All right. So I just want to start with 4 questions. What is your name?
Josh Ju.
What is the date?
6/19/21
Where are we?
at the clinic.
And what are we doing?
Doing a health assessment today.
Patient was able to correctly report the answers to my questions, and so he is alert and oriented ×4. Patient is well nourished and well hydrated, and height and weight is within normal range, and he demonstrates no physical deformities, and his position and posture is comfortable. He's sitting upright in an erect sitting position. Patient demonstrates no lesions, and he is well groomed and clean, and he has a relaxed facial expression, and his mood is pleasant and has a calm and happy affect, and his speech is English and Korean, which is appropriate for his ethnicity and background, and it's clear and articulate. The content is appropriate. There's no slurring, and the pattern is appropriate as well. Okay, so then after that, I am going to check his skin, and so patient's skin is tan, which is appropriate to his ethnicity and background. I don't see any lesions. It's smooth and of good texture. And I'm going to check for warmth or his temperature using the back of my hand. So, patient's skin is warm and dry. And I'm going to check for skin turgor. And the skin turgor is elastic. And so now can I look at your nails? So patient's nails are round. The nail beds are pink. And it's of good texture, it's smooth, and it's consistent in color and thickness as well. And the contour is 160 degrees. And so I'm going to check for capillary refill of bilateral index fingers and bilateral toes. So can you just put your feet up here for the purpose of this video? All right, and his bilateral index fingers and toes capillary refill is less than 3 seconds. So then I'm going to move on to his eyes, and I see that his pupils are black, round, and they're equal. His iris is brown. His sclera is white. His cornea is clear. And I'm going to touch you. And the conjunctiva is clear and moist. No swelling. No exudate. So now I'm going to just check for cranial nerve 2, peripheral vision. And so I just want you to cover one eye. And tell me how many fingers I am holding out.
2, 3, 4, 1.
Great, and this eye?
2, 3, 1, 1.
Okay, so patient was correctly able to identify in both eyes the correct number of fingers held on all 4 peripheral quadrants, which means cranial nerve 2 is intact. And then Now I'm going to do the cranial nerves 3, 4, and 6. So I'm going to check for corneal light reflex. And so I want you to look at the bridge of my nose, and I'm going to point the light at the bridge of your nose. Just look at the bridge of mine. And corneal light reflex was equal in both eyes, in the same spot in both eyes at 1 o'clock. And so just follow my pen, please, or this light stick. So patient's eyes moved symmetrically and smoothly in all cardinal fields of gaze, all 9 of them. And so cranial nerves 3, 4, and 6 are intact. And now I'm going to check for pupil reaction to light. Normally I would dim the lights, but for the purpose of this video, I am not going to. And so just look at my eyes and not into the light. Okay, so pupils reactive to light, and look at this pen light. And I checked for accommodation, pupils accommodated, so overall pupils equal, reactive to light, and accommodates. Pupils equal, round, reactive to light, and accommodates. Oh, and I also want to check for your size. So look here, and pupil sizes are 3 millimeters bilaterally. Okay, so eyes. I'm gonna look at your ears now. And so I see that the skin is tan, it's not cyanotic, it's consistent, the color is consistent with the face and the rest of the body. There's no lesions, no swelling, no exudate, no drainage noted. They're symmetrical in size and proportionate to his head, and they're symmetrical. And I also see, I'm going to feel them. Let me know if it's tender, and there's no tenderness with palpation to the ears. And now I'm going to have you kind of face forward. I'm going to have you cover one ear. Okay. I'm going to whisper 3 words. Repeat them.
Blue, black, brown.
And then cover the other ear.
Yellow, white, red.
Okay, so patient was able to correctly report the 3 whispered words in each ears, and so that means cranial nerve 8 is intact. So my ears. So now I'm gonna check for his head skin, and I see that it's tan. There's no lesions, not cyanotic, and I'm going to check cranial nerve 7. And so eyes are symmetrical, nose midline, mouth is midline. And I want you to raise your eyebrows, smile, frown. Okay, so facial expressions were symmetrical, meaning cranial nerve 7 is intact. And then now I'm going to check for your scalp. Okay, the skin color of the scalp is similar to the rest of the body, like the face and the neck, and the hair is distributed equally around the scalp. And then next I'm going to look at your hair. So I see the hair, it's smooth, black, and it's thick, and there's no lice or gnats, and it's well hydrated and clean. Then I'm gonna feel for your head. Is that tender?
No.
Okay. So the cranium is normal cephalic, and there was no tenderness, no lesions, masses, or soft spots noted. And then now I am going to test for your Tmj joint. So just go ahead and open and close your mouth. Oh, there it is. So Tmj moves smoothly, no crepitus noted, which is an expected finding. And then I'm going to palpate the frontal sinus. So let me know if it's tender.
No.
Is a maxillary sinus tender?
No.
Okay. So no tenderness to frontal and maxillary sinus palpation. And then I'm going to test for cranial nerve 5 sensation. So I want you to close your eyes and tell me if you feel sharp or dull and where. Left or right too. What do you feel?
Sharp left forehead. Sharp left cheek. Dull right cheek. Dull right chin.
Dull or sharp?
Sharp right chin.
Okay.
Dull right chin. Dull left cheek. Dull left forehead. Sharp left chin. Sharp right cheek. Sharp right forehead. Dull right forehead. Dull right cheek. Dull left cheek.
Okay. So patient was able to correctly identify sharp and dull sensations on the face, meaning cranial nerve 5 is intact. So now I'm going to test your smell, cranial nerve 1, and I have 2 smells here. And so I want you to close your eyes and tell me what you smell. And can you occlude one nostril? Okay, smell?
Orange.
Yes. And occlude the other nostril.
Lavender.
Great. Patient was able to correctly identify the smells in bilateral nostrils, indicating that cranial nerve 1 is intact. Okay. So, okay. So now I see that the patient's mouth and lips are moisturized, they're pink, they're not dry or cracked, no lesions. And then I am going to have you open your mouth. And I see that his teeth is white, no cavities, no cracks, and tongue is pink and midline. Oral mucosa, buccal mucosa is pink, no lesions. And let me see your gums. Gums are pink, no swelling, no redness, no bleeding. And now I am going to check for your tongue. And so I want you to say ah, ah. Okay, so uvula rises, meaning that the cranial nerve 9 is intact. And I'm going to test his gag reflex. Okay, so gag reflex present, meaning cranial nerve 10 is intact. I want you to stick your tongue out and move it side to side slowly. Okay, so cranial nerve 12 is intact because patient was able to move tongue symmetrically, smoothly, and without tremors. All right, so next I am going to check the neck. So I did mouth and so I just want you to tell me. I'm going to check carotid pulse. So carotid pulses 2+, symmetrical bilaterally, and then I'm going to palpate the lymph nodes. So pre-auricular, is this tender?
No.
Post-auricular, tender?
No.
Occipital, tender?
No.
And submandibular, is that tender?
No.
So patient reports no tenderness to the lymph nodes palpated, indicating a normal finding, no tenderness, and they were not palpable. And the neck of the skin is tan, no cyanosis, no lesions. And I'm going to test your range of motion. So I want you to look down and back, and then, yep, chin up to the ceiling, and then I want you to turn your head to the right and to the left, and then bring your right ear to your right shoulder, left ear to left shoulder. Great. And so range of motion of the neck is within normal limits. And then I'm going to have you push your cheek against my hand. Turn it, yep. And then turn this cheek against this hand. Great. And then bring your shoulders up. And don't let me push down. Okay, great. So muscle strength of neck muscles were 5 out of 5, indicating that cranial nerve 11 is intact. So now I'm going to test your pulses here, radial pulses. Radial pulse 2+, symmetrical bilaterally. Squeeze my hands. Hand strength is good. And bring your shoulders up like this. And don't let me push down. And don't let me pull up. So 5 out of 5 upper extremity strength. Now I'm going to have you kind of face that way. I'm going to take a look at your back. Okay. So I see that the skin is tan, no cyanosis. Skin is tan, no cyanosis, no lesions. I also see that the anterior to posterior configuration, anterior to posterior to transverse configuration is 1 to 2. So patient doesn't have a barrel chest or anything like that. And then I am going to, his shoulders are symmetrical and no muscle wasting is there. And so I am going to palpate. Tell me if you feel any tenderness.
No. No.
Was that tender?
No.
No tenderness to palpation of posterior lateral chest. And I'm going to feel for your spine. And spine is midline, no scoliosis present. Now I'm going to check the symmetrical expansion. My fingers are going to be at T9, T10. Okay, I want you to take a breath. Okay, and then breathe out. And so patient demonstrates symmetrical expansion of the posterior chest, which is a normal finding. So then I'm going to percuss the costovertebral angle. Tell me if that's painful or tender.
No.
Is that painful or tender?
No.
So no pain or tenderness with costovertebral angle percussion, which means there's no kidney issues. And now I'm going to auscultate the posterior chest. Normally, I would tell the patient to take a deep breath, take a breath in and out each time he feels the stethoscope. But for the purpose of this video, I'm not going to do that. I'm using the diaphragm of my stethoscope. So, auscultation of the posterior and lateral chest indicates clear breath sounds, no adventitious breaths noted. All right, thank you, and you can go ahead and turn around. And anterior chest, upon inspection, patient demonstrates self-regulation with breathing and non-laborious breathing. And his skin is tan, no lesions, and it's not cyanotic. And then I'm going to palpate for tenderness. So just let me know if you feel any tenderness. Is that tender?
No.
No tenderness to palpation of anterior chest. I'm also going to auscultate the anterior chest using the diaphragm again. I tell the patient to take a breath every time he feels the diaphragm, but for this video, I'm not going to do that. Breath sounds are clear and no adventitious breath sounds were noted. So next I'm going to do the heart. So with the heart, I'm going to listen with my diaphragm first. And I'm going to listen for the aortic, pulmonic, Erb's point, tricuspid valve, and then the mitral valve. And then I'm going to flip over to my bell and listen for mitral, tricuspid, Erb's point, pulmonic, and aortic valves. And S1 and S2 left dub is noted, which is normal. There were no murmurs, gallops, clicks, or rubs. And then next, I'm going to palpate the apical pulse, which is at the left mid-clavicular line down 5 intercostal spaces. So apical pulse is palpated right here, and I'm going to also auscultate there. And so regular rate and rhythm of the apical pulse was noted. And now I'm going to listen for murmurs of the heart. So I want you to lean forward for me, please. I'm going to use the bell of my stethoscope. Listen at the aortic and the pulmonic valves. No murmurs were noted there. And I'm going to have you lie down on your left side. Now I'm going to auscultate the apex of the heart for murmurs, which is located where the mitral valve is. And no murmurs were noted at the apex of the heart. Great. And then now I'm just going to have you go ahead and lay on your back. And are you comfortable still?
Yep.
Great. So I'm going to do an abdominal assessment next. So with the abdomen, I am going to first just inspect. So I see that the patient's abdomen is flat and it's symmetrical, and there is no lesions, and it's tan, similar to the rest of the body, and not cyanotic. And then I am going to auscultate abdominal sounds. So I'm going to start in the right lower quadrant and work my way clockwise. So right lower, right upper, left upper quadrant, and left lower quadrant. And normal reactive bowel sounds were heard. And I'm going to also auscultate for the abdominal vascular aorta. And no bruits were noted. And so now I want to do percussion of the abdomen. So right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. Okay, so patient's bowel sounds in all four quadrants were tympanic. It would be dull over the liver and the spleen. And then, I don't know if I said this, but the auscultation of all four quadrants were normal reactive. Okay. So after that, I'm going to palpate. So I'm going to do with light palpation first, and that tests for tenderness. So I'm going to do right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. Was that tender? So no tenderness noted with light palpation. Then I'm going to do a deeper palpation. Right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. And I feel no masses or enlargement, which is a normal finding. All right, Sarah, you can go ahead and sit up. We're almost done here.
Okay.
And then, so I'm going to have you scoot back so we can see your legs.
Okay.
I want to put your legs up here just for the purpose of this video. So I see that the patient's legs are symmetrical. It's tan, not cyanotic, no lesions. The hair is evenly distributed among the lower legs. And I'm going to check for varicose veins. And I don't see any varicose veins. And then I am going to assess for pre-tibial edema. And no pre-tibial edema was noted, no pitting. And then I'm going to check for the posterior tibial pulse and the dorsalis pedis pulse. And both of those pulses were 2+ bilateral symmetrically. Then I'm going to have you raise your foot up towards the ceiling. Don't let me push. And then I'm going to have you kind of hang off the couch and point your toes down. And don't let me pull up. Okay? Good job. So 5 out of 5 muscle strength. Dorsiflexion and plantar flexion muscle strength are 5 out of 5. All right, we're all done, and so I just wanted to thank you, and I just want to ensure your safety. So I'm going to leave this call light here. Push it if you need anything, and I'm going to maintain your privacy. I'll shut the door behind me, and is there anything I can get you or before I leave?
No, I think that's it. Thank you.
Okay, I just want to make sure you're comfortable. Okay, thank you.